I was a student here. I graduated in 2001, and in the spring, Stephanie Baugh and I had a conversation about bringing back a panel of alums to do the diversity convocation. And I, of course, got very, very excited because I'd like to think that I have some pretty awesome friends that I went to school here with. And 3 of them that are back today, actually 4, one popped her head in as the day went on. So I want to give everybody a shout out and give out some shout outs to everyone who made this evening program possible. So first, I want to introduce Carmen Alvarado, class of 02, Constance Jackson, class of 02, Kenneth Morris, Kenny Morris, or Kenny Love, as we affectionately called him in school, class of 2000. And I found out today exactly why Kenny Love came to fruition. I didn't know that all these years. So, and then...
I think it would be obvious.
It was, after he told us. And then, of course, Dr. Frank Clark, who is going to be, it's hard to call him Dr. Clark, but he deserves that. He worked his butt off for it. So, and he is going to be, he's our guest speaker this evening. I want to thank our counseling services, Cindy Beatles and Tom Caudell. I want to thank Marnie Dugan, and I want to especially thank Coach Haynes. Because when I went to him and I said, hey, Frank's coming back, we're making this happen. What do you think about doing a wellness and athletics conversation or a program? And he said, we don't get many opportunities like this, and we need to capitalize on it. So mental wellness is important. If you were able to be at the convocation this morning, I think all 3 of our guests spoke to that. And I'm excited to welcome Frank up in front of all of you to dive in a little deeper, okay? So can we give Frank a big round of applause?
How's everybody doing? Okay, can everybody hear me? I talk pretty loud. Okay. It's good to be with you all. It's good to be with you all this evening, and thank you, Regina, for having me back, and a special shout out to Coach Haynes, who was my coach when I ran track and cross country many years ago. Not that long, but it seems like it was just yesterday. And as I was looking at all you guys coming in, I was telling Regina, and I was telling Hey Love that you know, when we were here, I don't know if something like this would have happened. To have this talk, and so I'm thankful that Coach Haynes was receptive to me talking with you guys today. And well, thank you for the swag. I appreciate that. So I don't have any slides. I like PowerPoint, but at the same time, I like to have a discussion. Things are normal because I give lectures all the time, and this is kind of the space that I love. So let me tell you a little bit about me, because I know some of you weren't at the convocation today. How many freshmen did we have? Oh, okay. So, yes, we didn't see each other at the convocation. Sophomores. Okay, juniors and seniors. Cool. All right. How many track and field? Okay. Football, cross country, swimming. You guys have water polo here now too? Yep. Okay. Water polo. Okay. Baseball, softball, volleyball, basketball. Okay. I'm probably missing. Golf, tennis. Okay. Lacrosse. Yeah. See, we didn't have lacrosse. All right. So a little bit about me and kind of how I came into this field and things. So I'm from Chicago. Grew up in the south side of Chicago. I did my most of my schooling in Chicago, except for the exception of high school. Went to high school in Wisconsin, boarding school, Wayland Academy, which the person who gave me a shout out today, I thought it was a joke, but she actually did go to Wayland. So so that was good to see someone from Wayland. And then obviously went to Monmouth College, class of 2002, majored in biology, minored in chemistry, and then headed to Northwestern University for med school. And then after that, I did my residency in psychiatry at the University of South Carolina. Go Gamecocks, we beat Georgia this weekend, so we're happy about that. But, and then I practiced in Virginia after residency for a couple of years. Met my lovely wife, Dr. Jennifer Clark, who's also in psychiatry. And then we moved back to South Carolina, so we currently live in Greenville, South Carolina. Anybody ever heard of Greenville? All right, so it's one of the fastest growing cities, especially in the southeast, but if you haven't been, I encourage you to go. So we've been out there now for over 2 years, and we have a beautiful 9-month-old daughter named Claire. It's fun being a father. But so my journey is kind of topsy-turvy throughout my life. So as I mentioned in the convocation for you guys who were there, through my journey of exploration, I went through a lot of things in my childhood that I kind of, I'll say, suppressed, okay? And so when I got to college, I really didn't know who I was in terms of, my identity. I knew I was going to be a bio major. I knew I wanted to go to medical school, and I knew I wanted to run. Because I ran in high school, and running kept me sane, so to speak. All right, it was my outlet, and it still is. I still run. I don't run as much as I used to. I did the Boston Marathon the year of the bombings. 2-time Boston qualifier, ran once. But running is still part of my life because it does allow me the outlet to release any type of stress or frustrations that I may have. Being a physician is quite challenging at times, but it's also quite rewarding. So when I got to Monmouth, trying to figure out where I fit in, and I found that the athletic arena for me was a safe space because I was surrounded by teammates. Coach Haynes also looked out for me, believed in me when I didn't believe in myself, and I'm thankful for that. I was surrounded by a lot of people, a lot of good people. And so, but at the same time, I still had a lot of demons that I hadn't dealt with growing up. And so, when I graduated, and I graduated in 3.5 years, I was talking to Kay Love about this on the way over. One of the things, I still had a year of eligibility left for track. And Coach, I don't know if you remember that conversation we had in the band. We were trying to figure out a way that I could still run track, because I did 4 years across country. But my mom had paid for my college, and she was like, hey, the money's running out, like, you're coming out of school. So, and I understood that in retrospect. But I think that not having that sense of community anymore, not having the team, that started to weigh on me. So I actually moved into an apartment, and I was engaged at the time too. I'll put that out there, and that relationship went south. So relationship goes south. I'm feeling isolated now. Don't really have my support system that I used to. Even though I had a lot of things to look forward to, going to Northwestern University on a full ride scholarship, which was great. That was my dream school. That's where I wanted to be. I started to feel this sense of doom and gloom, and I was isolating myself, kind of all the classic signs, which I didn't realize at the time, but I experienced depression, clinical depression, and didn't get diagnosed until probably 2003. All right, and so the reason I tell you that also is that depression nobody in this room is immune to mental illness. Okay. If you look at the statistics, 1 in 5 people will experience mental illness. So and that's every year. So 1 in 5, that's about 47 million people in the U.S. 1 in 5. About 4% will experience what we call a co-occurring substance use disorder. That could be alcohol use disorder, marijuana use disorder, cocaine use disorder, in addition to mental illness in a given year. That's about 9.2 million people in the U.S. Okay? So 1 in 5. If you don't remember anything from this talk, 1 in 5. Okay? And some of you in this room may know somebody with depression or anxiety. It's quite common, especially on college campuses. And show of hands, how many people know somebody with depression or anxiety? I would expect everybody to raise their hand. Yeah, most people, the majority of people in this room know someone, okay? And it's something that is not talked about, okay? If you would have told me that I was going to get diagnosed with depression years ago, I would have said, no, that's whatever. I don't think so. Not because I thought that I didn't go through adversity, but I didn't think it would happen to me. And I said this morning, you know, my depression has been in remission now for 9 years. I used to take medications. I took Lexapro for a long time, and now I do my own therapy. And that's especially important to me because if I'm going to be caring for people, I have to make sure that I take care of myself. Because I know that I could also have another depressive episode, but I've done well over the years. But I know the things to do to keep me well. Part of that is running. I'm also a dancer, so I have other things. And let me clarify, dancer, that's like, I grew up tap ballet and jazz, I'm not stripping or anything. That out there, all right. So, my wife, I probably won't go home tonight to my wife. I used to work in a club though in medical school. That's a story for a different day, okay? But it affects us. And I'm not talking about sadness, okay? I'm not talking about, oh, I'm sad. Like sadness and depression are two different things. Who can define to me what clinical depression is? What does clinical depression look like? Anybody? Oh, in the back, yes. Go ahead.
Depression is more of like a constant state that doesn't go away, and it's like it could like minimize itself, but it will still be there regardless. And sadness, it can go away rather than just like always being there.
Yeah. It basically impacts your ability to function. That's the definition of a mental illness, right? So, how many people in this room have ever been anxious? Yeah, I mean, I think I heard somebody say they got how many page paper do you have for statistics?
No, I just have
900. Okay, 900%, right? Okay, you guys just had midterms, right? So that's anxiety provoking, okay? Every time I stepped foot on the track, I was anxious, okay? Performance, right? You're trying to perform at a level that you feel that is good. Or excellent, you're trying to excel, right? Not just excelling in the classroom, you're excelling in the athletic arena. That could be anxiety provoking, all right? But when it comes to mental illness, it is impairing your ability to function. So when I was depressed, and this happened even when in medical school, I wasn't getting out of bed. I was always one that went to lecture in college, okay? We didn't have cell phones during that time, and iPads and all that good stuff. You guys have your resources, right? So I went to class, but in medical school I wasn't going to class. Not because I didn't want to learn. I was depressed. Wasn't eating. Had no motivation to do things. Wasn't exercising. Right? And it was impacting my ability to function. Actually had thoughts of suicide at one point. But I was able to again persevere, and I got the help that I needed. I actually lost my full ride. Okay, I didn't tell you guys that in the convocation this morning, but I lost my full scholarship. So I failed my first year of medical school. Right? That was a blow. All right, I'm already depressed because of other things that I had mentioned. And then to get into medical school and to find out that I didn't pass my courses, that was a huge blow to me. And I remember my mom saying, you know, get back in there, you can do this. But I was depressed. And then came back and I passed my first year of medical school. Then my second year of medical school came about and I did decent. And then I had to take a board exam. So in medical school you have to take what we call step exams, step 1 and step 2 before you can graduate. And so I failed step 1 and had to take another year off. Came back, passed that, and then I had some problems during my third year where I didn't pass one of our rotations. It was surgery and I had to take the test like twice. So instead of, medical school is 4 years. So instead of 4 years, it took me 7 years to finish. Okay? And I'm grateful that happened actually, because otherwise I wouldn't be standing in front of you today, addressing you and talking about my journey. And so now I'm in debt, but I'm in good debt. Okay, and debt that will be paid off. But depression, going through depression for me has allowed me to be a better man, a better husband, a better father, and a better physician. And I would even say a better athlete, because I still run, and I'm more empathetic. Not that I think people would always describe me as empathetic, but when you go through things and you go through adversity, you can handle it one of two ways. You can kind of have the pity party, or you can say, you know what, this happened to me, and I'm gonna, what did I learn from it? So, stigma. Is there a stigma when it comes to mental illness?
Yes.
Yes? Why? Why is there a stigma?
It makes you look weak.
Makes you look weak. Okay. Right? Especially if you're an athlete. Right? I'm going to pick on the guys for it then, right? Because guys, we're supposed to be macho. Right? We don't talk about our feelings, right? I'm looking at the Three Stooges over there, Two Stooges, I guess. Right? Right? Right, guys? We don't talk about our feelings. But I told you 1 in 5 people have a mental illness. But if I said, if you said I have diabetes, nobody cares, right? I mean, not to say nobody cares, but there's not a stigma, right? There's not a stigma. There's not a stigma with diabetes, right? How many people know people with diabetes? Okay. If somebody says I have diabetes, no one's like, oh my God, what's wrong with you? Right? But if you say I just got diagnosed with schizophrenia, you crazy? Right? We love to use that term. But if I told you if you have diabetes, that increases your risk for developing depression, and if you have depression, that increases your risk for developing diabetes, would you believe that? It's true. Right? So people with mental illness have a 10 to 20 year shorter lifespan than the general population. 10 to 20 years. Okay? That's significant. And it's not that necessarily the mental illness kills them, it's all of the comorbidities. Diabetes, heart disease, right? So if you look at the top 10 leading causes of death in the U.S., suicide is one of them. How many people knew that? Yeah. Suicide is one of the top 10 leading causes of death. Okay? If you look at depression, depression will be the second, or actually the leading cause of disability by 2020, which is next year. Not heart disease, not lung disease, depression. Okay? But there's still the stigma that we talk about. Okay? Now, then we bring in athletics. Okay? Who knows, well not who knows, but you may know him, I don't know, but Delonte West, does that name ring a bell? Okay, who knows about Delonte West?
He's an NBA player.
NBA player.
He's about, well, he's on the bow, I know that, but
He is, yep.
did he was diagnosed with bipolar? Why did he?
I don't know what he was doing. All I remember is somebody sending me a picture of him on the street, looking emaciated and looking like he was strung out on drugs and definitely homeless. Yeah. Yeah, that's all. Yeah. So the reason I used Delonte West because this is okay. You got an NBA player who was making millions, played for the Cleveland Cavaliers, and I think he played for another team at one point. Celtics, yeah. And now he's on the street. Okay. Likely has a mental illness. Most homeless people, the majority of homeless people, have a mental illness. Would you believe that? Okay. And you could even argue that majority of homeless people have a substance use disorder. Okay. The reason I use Delonte West goes back to my point of mental illness. Nobody is immune to mental illness. Just because you have all this money doesn't mean that you don't get depressed. Right? I can't stand when I hear on the radio, and I'm a man of faith, and I'm saying that, I'm putting that out there because on the radio sometimes I listen to all types of music. People will say, I'm too blessed to be stressed. I can't stand that. I don't even know what that means. What do you mean you're too blessed to be stressed? We all go through stress. So you can go from making millions to be homeless, okay? Other NBA players that have struggled with mental illness. Kevin Love talks about his battle, and I'm glad that the NBA and NFL and other organizations are doing this. Actually, there is now where the NBA is requiring each team to have a mental health professional. And I think the NFL is doing the same thing, which I think is awesome. You didn't hear about that 20 years ago, even 10 years ago. But people are recognizing that mental illness is a real thing. It's a real thing, and it can affect us, and it can impact our ability to function and live and reach our full potential. Okay? So, does mental illness happen in athletes? Do you think it happens here? I'm not asking anybody to do self-disclosure. I'm just saying, does it happen here? Yeah. You guys talk about it? You guys feel like you can share? Like, do you feel like you can share? Like, if you were feeling depressed or anxious, or is there such a stigma where you're like, you know, I don't want to be viewed as weak if I come up to my coach and tell him that I'm not doing well? You're shaking your head. So what does that mean?
No, I don't think that's good in the position.
Okay. Why don't you do that? I'm glad to hear that. Why don't you do that?
I think it depends on who you're going to hang around with. So for myself, we've been asking these questions like, do you see this stigma anywhere else? No. But that's just me personally.
Okay. What about others? Yes, ma'am.
Yeah, I feel pretty comfortable talking to myself. I'm bad for that. Like, I feel pretty comfortable talking to them. And I have a hard time with my coach, especially.
Good. Good. So when I'm hearing overall, people feel comfortable with approaching their coaches. That's great. Can't say that doesn't happen everywhere. That doesn't happen everywhere. Oftentimes people get scolded, right? So you come up to someone, I'm feeling depressed. Well, big deal, right? So words matter, right? No one likes to feel invalidated, right? Right? You know, if you come up to someone, and this doesn't happen in the athletic arena. This happens at work and other places. No one wants to feel like shot down. I mean, everybody's feelings are valid. So I'm glad to hear that you feel comfortable talking to your coaches and other staff about things that you're going through because it's important. Right? Suicide is on the rise. Okay? I know that's a topic that probably doesn't get talked about sometimes, but it is on the rates of suicide are going up. It was a study that just came out recently where suicide, there's a lot of risk factors for suicide, and it used to be, the classic risk factors would always be, if you were an old white male, you had a high risk for suicide. In general, blacks, we have a lower risk of suicide in general, but that is actually changing. So there's a study that just came out recently that showed that black adolescents have an increased risk of suicide now, which is new. You never heard about that. You never heard about black youth committing suicide. And that's compared to, the rates are higher compared to whites, Native Americans, Hispanics. So that's new. Okay? But overall, if you look at the suicide rates, they are increasing. And there's multiple reasons for that. Why do you think the suicide rates are increasing? That is one. Stigma, distrust of the medical system. Okay. Anybody ever heard of the Tuskegee experiment? Okay. All right. Yeah. So for those who have not, that's your homework tonight. I know you probably got other things to do too, but read about the Tuskegee experiment. It's a good, it's good knowledge to have. But yeah, stigma. Distrust of the system, lack of access to care, and in general, there's a lack of access to care. The only time we want to talk about mental illness, and I say we, but I'm talking about society or the media, right, is when there is a mass shooting, right? So Virginia Tech, Columbine, Sandy Hook, right? People will usually say, oh, that person must have been mentally ill. And that is making a quick assumption about something that we don't know, or a person that we don't know. If you look at the studies, you can only attribute 3 to 4% of violence to mental illness, which means that the majority of people who are mentally ill are not violent people. Actually, people with mental illness are more likely to be victims of violence than they are to commit crimes. Okay? Because all of us raised our hand in terms of how many people we know with depression. And I would ask you, out of all those people who you know with depression, do you consider them to be violent? I think most people would probably say no. Okay. So, in the athletic arena, they did a study where they looked at, they were looking at the prevalence of depression in college athletes, and I think it was a D3 school in the Northeast. But the study was interesting because it had a lot of sports involved, but it excluded football. And I have questions about that. I didn't email the authors, but I wanted to know why they excluded football. My hypothesis is that with this macho mentality that football players may have been less likely to reveal that if they were having depression or not. Now, I don't know that to be true, but that was my hypothesis because they included track and field, they included lacrosse, swimming, volleyball, but they didn't include football. But what they found was that there is a high prevalence of depression among college athletes. I think it was like about 24%. And some of the sports that had the highest rates of depression was women's track and field. Is that surprising? Why is that not surprising?
I just would say, because I'm on the track team, so like the only people I know is track people. So I've just noticed it like throughout the years because I've just been in track almost like my whole life, and so I've seen it a lot more than any other sports, or at least I've noticed they've talked about it more.
Okay.
So that's how I knew it was going on.
Okay. I was actually surprised by the results. I didn't think track and field would actually be the highest. Lacrosse actually was one of the lowest rates for depression, which I thought that was interesting as well. But one of my colleagues who does a lot of research was saying that with track and field, obviously you have like the 4x4 and other, but it's mostly an individual sport. And so there's a lot of pressure put on yourself. Like if you don't perform well, it's you're like, okay, I gotta own this and say it again.
I just said this makes so much sense.
Yeah, there's a lot of stress, right? A lot of, right, you know, and then you kind of get into this feelings of, oh my God, I'm a failure. And I'm not saying people feel that way, but it is that, you know, that's what the hypothesis is that with track and field compared to maybe like basketball or football. But in general, and notice I didn't say male track and field, I said female. In general, and this is not gender stereotyping, this is what the evidence shows, depression is more common in women than men. Now, that doesn't mean that men don't develop depression. But in general, women are at higher risk of developing depression than men. Okay? If you look at bipolar disorder, there is no gender predominance. It's equal, male and female. If you look at schizophrenia, males tend to develop schizophrenia around ages 18 to 20, and women tend to develop schizophrenia around 22, 23, 24. Okay. All right. But the studies show basically that there is a high prevalence of depression among athletes. But yet, people are still not talking about it. Now I know we're talking about it here, and I know most of you have said that there doesn't seem to be a stigma here, but that's not happening on every college campus. And that's a problem. Because if you look at other college campuses, there have been suicides. Okay, that's another thing that people don't talk about on college campuses. There have been suicides. Okay, and in the athletic arena, what they have found is that the athletic arena can serve different purposes. So for me, the athletic arena kept me grounded, and I would say in retrospect, it kept me from probably being depressed for all those years that I didn't know I was depressed. But it kept me grounded, and it was a positive thing for me. That's not but that's not everybody has that experience. If you've already got things going on in your life that maybe you haven't addressed, or just things that have happened, and then you step into the athletic arena, it could get worse. Okay? Anybody been injured? Okay. All right. I was fortunate in college. I did not experience injury, but injury can have some psychological burdens as well, right? So if you get injured, what types of thoughts go through your mind?
My immediate reaction is like, what did I do to get this?
What did I do to deserve? All right. What did I do to get this? What did I do to deserve this? What else?
Am I ever gonna jump again?
Okay. I had those thoughts. So when I was training for Boston, and I was living in Columbia, South Carolina. This was during residency. I had some micro tears in my hamstring. And remember, I was never injured, and so I had those thoughts. I'm just like, you know, what's going to happen? Like, running is an addiction. Okay, it can be it's a healthy addiction. Okay, right? That dopamine gets stimulated. Right. Right. I like Skittles too. That's my other addiction. But running is. I was miserable when I was injured. I was miserable because every day I was going to work and I would see runners on the street and I couldn't run. I was pissed because I was like, I need to be out there, right? And then I went through this guilt, like, oh, I'm not doing and things. Now, I eventually got, with the help of my trainer and actually resting, you know, not overtraining, right? There is something called overtraining syndrome, okay? But I had to be smart about it. But I went through those thoughts. Am I ever gonna, you know, will I ever run again? Especially because I know what running means to me, right? So, we go through these thoughts and we start feeling guilty. We blame ourselves. You start questioning yourselves. What did you do to deserve that? And think about it. Take it from not just even college. Take it to the elite athlete, right? How many elite athletes do we see get injured all the time? Right now the NFL's got some, this guy just passed away, but the boxer, I think I heard this morning, 27-year-old guy gets knocked in the head, traumatic brain injury, he dies. All right. But injury can definitely play on our emotions. Play on our emotions, okay? Nobody in this room is retiring from sports, right? I mean, you guys are too young for that, right? Unless something happens, right? But retirement is another thing, right? Every day, and I'm shifting to to elite athletes, right? So it's hard for them to step away from the game, right? So you go into retirement, but retirement in anything, but in athletics, right? Each day, this is what you've been doing this is all you know, right? Some people handle retirement very well, and some others don't. They go through almost like a midlife crisis, and that can be very debilitating and depressing. I don't know. You guys watch the 30 for 30s? Okay. You ever seen the 30 for 30 about Junior Seau? It's very sad what he went through. And obviously he ended up having CTE, which we really didn't. You guys familiar with CTE? Chronic traumatic? Okay. When we were growing up, we didn't know about CTE. I actually met the guy who they did the movie after, who did the research for CTE. He actually won an award, and it was at a medical meeting that I was at. Real nice guy. But retirement does things for people because it's like, again, that addiction, right? You're so used to doing something every day. You're so used to having that structure, and it doesn't get talked about. And what do you do after that? Okay. So injury is one, right? Retirement, overtraining, and so you have to look at all those things as an athlete, and then the expectations that you set for yourself, right? And in the convocation this morning, I talked about perfectionism, right? We strive for that, If I could just jump a little higher, right? If I could just, anytime I run, Coach Hayes is in my head because I will never forget. He always turn it open, pull it back. That's all. When I'm doing marathons and running, and you guys are laughing because he probably still says that, right? All right. So,
That's positive, right?
That is positive. No, absolutely. Yeah, when you're in my head, it's positive, right? Yeah, it is positive, right? Because he cares, right? He's not trying. He doesn't want you to get hurt. He's telling you things to help you, to help with your performance, right? But then there's that. But then there's that other side that, right? We get into our own head, and it's like, well, I'm not doing as well as I could, right? Because we compare, right? Comparisons are dangerous, right? Because if I know a guy I ran with, Brian Bender, tremendous athlete. I knew I was never going to be as fast as Brian Bender, and that's okay. But we had some good practices, and your teammates make you better. That's one thing. But if you start comparing yourself to others, then that's depressing, right? Because you're kind of like, oh well, he or she has this, and they seem to do this. But that's them. That's okay. You're still special. All of you in this room are special. Have you ever thought about it that way? I'm not seeing people shake their heads or shake their heads. No, okay. All of you are special. You all have God-given ability. Okay? That's when I got to medical school. That was a wake-up call, right? Because you do well for so many years, and then you get into medical school, and you're like, oh, this is the cream of the crop, because you realize that there are people that are smarter than me, and there's always going to be people that will be smarter than me. There's going to be people that are faster than me. Okay, I ran the Boston Marathon in sub 3 hours. I ran 2:54. That's moving. But there was a 60-year-old that was passing me by. And I'm like, wow, good for that guy. But I still ran 2:54. So learning how to be content, if you're going to compete, obviously, allow your teammates to make you better, but remember, as long as you're doing your best, that's all you can do, right? If you're giving a mediocre effort, that's one thing. But if you're doing your best, then hopefully you can sleep well at night. But again, we live in this society of perfectionism. I got to be doing more. Well, what evidence do you have that you have to be doing more? Unless you're slacking. There's a difference. But that can weigh on a person, right? And remember, you guys are student athletes, right? So I'm sure if you're having that mentality in the athletic arena, that's probably happening in your school, in the classroom as well. I talked about that a little bit in the convocation as well. So all these things can impact us. And I think the things that I have learned over the years as being an athlete, being a physician, being a husband, being a father, is that I don't have to be perfect. I am who I am. Now, I wouldn't have said that to you back in 1999 when I started school, when I started college here. I wouldn't have said that to you. It's taken a while for me to get to that point where I can say I'm comfortable with who I am, not who people want me to be. Right? There's a difference. Right? Who you are and what people want you to be are two different things. College is supposed to be a maturation process. Okay? By the time you are seniors and you graduate, I hope that you leave differently than when you came in. Okay? Not only as athletes, but as students, all those things. But you don't have to be perfect. Be you. Be your best you. I think Abraham Lincoln said, whatever you are, be a good one. Do your best. Right? No one is ever going to ridicule you or berate you because you did your best. But I think, again, perfectionism is very debilitating. And depression is very debilitating. Anxiety can be very debilitating. And I'm glad that you do have the resources here and a safe space that you can talk to people. Because I see people every day who come to the hospital that don't feel like they can talk to people, right? They'll tell me, my family doesn't understand depression. My family doesn't understand what I'm going through. They expect me to just get over it, right? I've never told one of my patients that's come into the hospital that says they have depression and anxiety, well, you just need to get over it. That doesn't help, right? Because I would never tell somebody who was suicidal, like, oh, those thoughts will go away in a couple of hours, just check back later with me. No, I would never say that. I, unfortunately, as a psychiatrist, have had patients commit suicide. I had my first patient commit suicide when I was my first year out of residency. And no matter how many years that I have done this, it never is easy. But it's kind of inevitable being in the field that I am in, that Carmen can attest to that as well. The field that we're in, we know people are going to harm themselves, and we don't have answers always. But I also know that I can't prevent someone from committing suicide, but I can help give them the resources and validate their feelings and help them understand that people do care about you. So I encourage you, and I'm going to leave it some time for question and answer. I encourage you as you go out, as you go forth in your athletic pursuits, in your career pursuits, whatever those may be, know that you are not alone. Be mindful of who you are, not what others want you to be. Be mindful of who you are. Don't be afraid to ask for help. If you are struggling, it doesn't even have to be your coach. Turn to your friend. Turn to one of your teammates. If you see something in one of your teammates that you're like, so-and-so hasn't been to practice for a while, check on that person. Don't just say like, well, I guess he or she is okay. Go check on that person. Because you may be the difference in that person seeking care. We all care about each other. Well, we all should care about each other in our country, in the world. I mean, no one wants to see anybody pass away from suicide or whatever it may be. But be the person that you're called to be. Like I said, everybody in this room is special. You all have unique talents and abilities in the athletic arena and in the classroom. Use those to the best of your ability, but don't leave your fellow man and fellow woman hanging. If you see somebody struggling, reach out. And that's not to say that you have to be a psychiatrist or that nobody's asking you to play the psychiatrist, the therapist, the psychologist, and you don't have to do that. But just listen. Listen. And then listen to yourselves. Okay? I don't know if anybody journals in here. Does anybody write? Okay. You find it to be helpful?
Yep.
Okay. So I write poetry. That actually saved. So I wrote my best. I self-published a book called The Other Side. It's a collection of poems, and I did that during medical school because, like I said, I went through a lot of depression in medical school, but that kept me grounded as well. Find what fills your love bank. Okay. Find what fills your love bank and cultivate that. Own it. Okay. And just be true to yourself. So I want to open up this time. We got 30 minutes. I want to open up this time for question and answer because I can talk about this stuff all day. But
All right.
Do it.
You mentioned that you did self-therapy.
Yeah.
How did you do that?
So psychotherapy. So there's different forms of talk therapy. So what I did. So in medical school, I saw a psychiatrist. And then when I got to Virginia, I saw a psychologist. And so we met in Columbia, South Carolina, I saw a psychologist. So we met once a month, actually not weekly. And so 50-minute sessions where we processed a lot of the things that I had not processed in my childhood. And once I left South Carolina and went to Virginia, then I saw another therapist, and so I met weekly with her. And actually, I still see her weekly, but I do it through we call it telepsychiatry, so it's through a
I know it's years and years, you can't answer the question, but I know you'll give us a good answer. When I look at kids that I work with, and it's a generality, but we've all had different tough things growing up and in our childhood that we tend to dwell on too much. When I look at a student at Monmouth, I see 95% possibility and 5% difficulty. What is it about human nature that makes us crawl back into the 5%, and what should we do about it for ourselves before, I know you're going to say, talk to people that can help you, but what's a self-help thing that we can do for ourselves? Why do we crawl back into that difficult place instead of appreciating where you are and what you're doing?
That's a good question. So I think things that, I don't want to call them triggers, but I think sometimes we crawl back is because something happens to us in the present moment that brings us back to, and if we haven't processed it at that time, we're more likely to, it festers, and I have found that to be true in individuals that I've worked with, where things will just be going well, and all of a sudden, that 5% shoots up, and it's like, I'm doing so well, and what happened? And I find it can be a trigger for something that happened way back. That then it's like, oh well, I thought I was over that. It's like, well, you never necessarily get over it, but you process it in a way, and so I think if people are able to process that, that helps. There's also, they have these, they call them resiliency genes, and a lot of stuff with the environment and things like that. So if you take somebody who's gone through some type of trauma, not everybody who experiences trauma develops PTSD. Just like not everybody who smokes cigarettes develops lung cancer, but for a certain group of people, like I use myself with the Boston Marathon, I heard the bombs go off, but I didn't have any nightmares, flashbacks or anything, but the person next to me, who maybe had a history of trauma, that brings them back. Yes?
What do you do, or how do you encourage someone to seek help if they don't want to?
That's a very good
Frank, will
question.
you repeat the question? I wasn't.
Yeah, how do you encourage someone to seek help when they don't want to? So, I'm a firm believer of meeting people where they are. And what I mean by that is there's something in one of the therapies we use called motivational interviewing, where you roll with resistance. Okay, so if someone, if I think that someone has a problem with alcohol, but they're telling me alcohol's not a problem for them, me saying like, well, if you keep drinking alcohol, you're gonna die, you need to seek help, they're not gonna do that. But if I ask them, help me understand what alcohol does for you. What are the benefits to using alcohol? Are there any risks to using alcohol? People may be more likely to do that. Now, with that being said, in terms of seeking help, there's some times where you just have to intervene. Okay? So, if a person tells you, I'm suicidal and I'm getting ready to go jump off of the Huff Center, you need to intervene. There's no, well, if I think you should seek help. No, that's an intervention. Like there's no ifs, ands, or buts about it. You have to intervene. But if someone is depressed and they say, I'm depressed, I know I am, but I don't want to seek help, I would still say, I would give them resources, and you can even validate and say, I know this must be hard for you. I'm here if you want to talk. You can still check on that person, but you can't force anybody. No one does things. No one likes to be forced to do anything. But there are emergencies and then there are non-emergencies. If someone is telling you that they are suicidal and they have a plan, you have to intervene. If someone is telling you that they are homicidal, you definitely have to intervene. Okay, so we forget about the homicide thing too. If somebody says, I want to kill Coach Haynes, you need to let Coach Haynes know that. Okay? Right? And I mean, I'm serious. I'm serious. That is a duty to warn. Okay? Now, you know, Regina and Constance and Ken Love. I mean, yeah, there was times we didn't like Coach Haynes. He knows that. All right? I think all of us in this room can attest to that, right? It's one thing to be like, man, I can't believe Coach Haynes made us do Baylor's today. It sucks, right? Y'all still doing Baylor's? Okay, good. You still hate them, right? Right, exactly. People hate Baylor's, right? They make it faster, right? Okay. So that's one thing to being like, man, I can't believe Coach Haynes made us do that. It's another thing to be like, you know what? I want to kill Coach Haynes, and I want to take. That's a different story, right? That's an intervention, okay? So you have to be mindful. Those are emergency situations, right? But to the question of how do you got to meet people where they are. Meet people where they are and say, I'm here for you. You know, and ask them, what do you think would be helpful for you, since you talked about feeling depressed and anxious, what can I help you with? Or what would be helpful for you? When would you like to come with me to the counseling center? Or what, you know, kind of get their sense of where they're at. And then you can still check on them. You can still do those things, but it can be difficult. It can be difficult. On that point, if you ever lose a loved one to suicide, and please hear me when I say this, it is not your fault. Okay, and I'll tell you this from personal experience. Even being a psychiatrist, I told you I have lost people to suicide. And the first thing when I get that call that my patient hung himself, or they shot himself, I immediately go into these cognitive distortions of, oh my God, what did I do? I didn't protect them. I couldn't, but it's not my fault. But we have this feelings of guilt that if I could have just intervened, that person would still be here. And there's really no evidence of that. I tell families all the time that I'm sorry that you lost your loved one. And that's a hard pill to swallow. But I know that I assess them for suicide. I do a suicide risk assessment. I look at everything, and you do the best you can. Actually, the people who I found that have told me that they were going to commit suicide didn't commit suicide. The people who told me that they weren't going to commit suicide were the ones that actually did commit suicide. Now, that's not a rule of thumb, by the way. But that's been my experience. But nonetheless, it still sucks. What else? Yes.
I'll
Hey.
jump in.
Hey, Constance.
Because, sometimes I teach at my church, and it becomes easy to always talk about the other person. But I know somebody in this room is dealing with it. And you gotta kind of be honest with yourself. And as he said, now, I know you mentioned suicide a lot. But it doesn't always lead to that, and it's not always the person that looks a certain way, because I'm one of those people. So I might walk outside this building and see a lot of accolades, but the inability to get up and go to class, the panic attack, to not want to go to class, is why it took me, I don't know how many years to finish my degree here. And it doesn't become obvious. You can talk normal to people. So like somebody in this room is feeling some type of way, and I'm happy that whoever said that they feel comfortable to talk to somebody, you do that, you reach out. I would have never killed myself, but I know what it is to be on Effexor and all kind of things. Even with me having 2 toddlers, I just got over postpartum depression just a year ago. And my only outlet has ever been running, just like Frank. If I don't run, I feel lost. And I know at some point my legs are too old to do that. So my next outlet are people like you. So I coach. That's my outlet. And it doesn't always look like suicide. It doesn't always sound like I'm going to kill Coach Haynes. It doesn't. But when I sit back and I think of times, I wake up, or I never went to sleep, actually. And I knew I had class. And I knew I had bad grades. And I knew if I didn't get my shit together, I'm sorry for the camera, that I would have to write an appeal to the school. But it wouldn't shake, it still didn't stop. And it really took, for me to actually go and get the medicines I needed was when it got so bad, I didn't show up to track practice. That's when I know it went too far. Because that was one thing I was always willing and able to do. Because it was the only time I felt a little bit normal at times. So mine would go in cycles. I don't know if that's major depression or whatever, but there's some great, sometimes I'm just on the go, happy-go-lucky, and then there's sometimes you don't know where I've been. And I think they know this. So it's not always the other person. You got to be real honest with yourself, and if you feel yourself doing that, take a lesson from Tommy girl here that took like 6 years to get stuff done. Go find help somewhere on this campus.
So Constance and I went to school together,
We were housemates.
we were classmates, and I never knew that about her. Just like she never knew what was going on with me. And this is someone who is decorate. Yes. And by all that, yeah, that's the best word I can use. I got the chance to see her win many titles, but she's being transparent and she's being open with you in how she felt and how she feels. And I would encourage, again, be true to know yourself. Know yourself. It's okay to, it's okay. 1 in 5, okay? 1 in 5. 1 in 5. What else? Yes, ma'am.
So you were talking about how athletes face the stigma of not being able to be vulnerable, and somehow athletics become our bridge between the alignment of our mind, our body, even our souls, our identity, and how we interact with our environment. And I think it's difficult for people to battle those stigmas when we've been raised to almost not express ourselves. So how can we make ourselves advocates to people who are going through these experiences, but also to ourselves? Because it's hard for us to tell somebody else to open up when it's hard for ourselves to open up.
So in the congregation, that's a very good question of how can we advocate for others, but also advocate for ourselves. So in the conversation this morning, I mentioned the term self-compassion. Right? And that goes across the board, whether you're an athlete, whether you're, whatever your skill set is, you have to love yourself enough and respect yourself. I talk a lot about this, especially in the African American community, where we are taught to be strong. Okay? Even to this day, I've accomplished a lot in my life. I have a mom who is in a assisted living now, who has dementia, and she still doesn't, even when she was functioning at her best, has never understood what it means to be a psychiatrist. And when I told her that I was depressed towards the end of college and medical school, it was almost like you'll be all right. And I don't blame her for that, but it was how she was taught. Now, I think my mom is depressed. She'll never admit that. But it was taught to don't express yourself. Just be strong. And I think for black women, and the depression affects everybody, but I'm using the case and example because this is very prevalent in the African American community because we are not talking about it and we need to talk about it. Black women are more likely to go see therapists. Black men, that's a joke. It's a joke. Even if I look at like the clinics that I work at, I rarely see a black man come to the clinic. Rarely. And if I do, he's usually coming with his wife. Not because he's being seen, it's the wife who's being seen. Right? There is so much in our society that happens where I feel like black men, we as black men, we need to go. But we got to change the narrative. And so self-compassion is what I preach. I'll use I'm gonna use stereotypes here for a second. So who has ever heard of the angry black man stereotype? There, people can raise your hand. This is a safe space. Okay, right? The angry black man stereotype, right? If we raise our voice and we get all, animated, we're the angry black man. But have you ever stopped to think that maybe the angry black man that people are portraying as angry is actually depressed? Because depression looks different for everybody. So when someone tells me, oh, that person's just being angry, I'm like, well, maybe the person's depressed. Maybe that's trauma. So I'm really big on self-compassion. Because I know this I would have never told you I would see it. If you would have told me I was going to see a psychiatrist throughout my life, I'd have been like, nope. But I tell everybody, I have no shame in my game. I'm going to see my therapist. Having a good time. And I love therapy. Because therapy helps me, again, take care of myself, and it helps me advocate for others. But it starts with us. You may have family members, like Constance says, somebody in this room is going through depression right now. Somebody in this room is going through anxiety. Even though my mom doesn't understand what I went through, I still try to educate her about it and say, Mom, this is what depression does. Because my mom, when she found out I was depressed, it was like, oh my God, your career is done. You're never going to make it to medical school. I mean, she truly, and my wife knows this, I mean, she truly believed that my career was over. And I started to think that way as well. But she wouldn't have said that if I told her I had high blood pressure. She wouldn't have said, oh, Frank, no, she didn't. But with depression, my career is over. You've messed up. Almost like it was my fault. Right? Depression is not a moral failure. PTSD is not a moral failure. Anxiety is not a moral failure. It is an illness. Addiction is not a moral failure. That's the other stigma. People say, oh, why can't that person lay off the alcohol? It's not that simple. Because all of us right now, and this is not happening, if I say let's go smoke some weed, I actually told that to a med student once, and she said yes, and I was like, you should never tell your supervisor that you want to go smoke weed. I'm grading you, not the best thing to do, okay? But if a couple of us right now went to go smoke weed, a couple of us may say, whatever, I really didn't feel anything. But there could be that one or two people that say, I really like this. Because my nucleus accumbens, my dopamine centers are lighting up and saying, give me more of this. And the next thing you know, right, people are being referred to as potheads and like, oh, this person smokes weed and stuff. And then, when it's not they're a pothead, they will do anything they can to get the marijuana because they like it. It is allowing them to function. Because it's an addiction. Addiction can impact your ability to function. But we stigmatize addiction as well. We stigmatize addiction. But now we got this opiate epidemic. Everybody's heard about the opiate epidemic, right? Right? I'll give you a highlight into what we look at in terms of mental health disparities, all right? So everybody, in this generation, people know about the opiate epidemic, okay? But some of our older people in the room, including myself, remember the war on drugs, which was crack, okay? But at that time, right, if you say opiate epidemic, who's the person you think about an opiate epidemic? What do they look like? Caucasian. War on drugs, crack. What's the person you think? What does that look like? Black people. But isn't it funny? War on drugs, we gotta incarcerate people. That's why you have a mass incarceration of black people. And the new mental health hospital is actually the jail and prison system. But the opiate epidemic, let's help all our white brothers and sisters. This is horrible. But what people fail to realize, opiate epidemic is not just affecting our white brothers and sisters. It's affecting blacks, Hispanics, Native Americans. But isn't that interesting? Right? So, love yourself, self-compassion first, and then you can advocate for others. So, we got 5 minutes. Oh, okay. You're just taking a side? Okay. Yes?
So you talked about depression and anxiety, suicide, and that can happen without any triggers,
Right.
without trauma. I mean, it can happen to somebody. But what are some tips to avoid, you talked about a complication like burnout or just stress in general? What are some mental wellness tips that can help reduce chances?
Sure.
It's a lob ball, Frank. You gotta hit this one out of the park.
I know. See, that wasn't even a planted question. So tips. Sleep. Sleep is important, and I know you're like, Frank, we're in college. We don't sleep, right? We all felt the same way, right? Because when you're in your 20s, you're like, I'm invincible, right? I can pull an all-nighter, and I can get up, and I never pulled all-nighters. All-nighters don't work, by the way. Okay. But sleep. Sleep is important, right? You got to reset the clock. How many hours of sleep are you guys getting? Be honest.
5 and 6.
5 and 6? Okay, that's decent. That's decent. I thought you guys were going to say like 3 or 4 or something. Okay.
There you go.
Sleep is important, right? I don't get 8 hours. Okay, I've never gotten 8 hours. I function well on 6 to 7 hours. Now, with a baby, 5 or 6. Okay, but sleep is important. You have to restore the clock, right? Because if you're not sleeping, how are you going to function? Okay, and you can drink all the caffeine, and I used to have one person in class that always bring a Mountain Dew in the morning. I never could understand that, but I know people are like, do you drink Mountain Dew? Oh, okay. All right. But sleep, you got to reset the clock. Because if you are not waking up refreshed, you are not going to be able to function. And if I told you insomnia was a risk factor for depression, would you believe that? Insomnia is also a risk factor for suicide. Okay? So sleep. Try to get at least 6 hours. Try to get 6 hours. Okay? And try to go to bed at the same time every night. Okay? Nowadays, you guys have the iPads and the iPhones. And I was talking about this with the professors earlier before we came over here and stuff. Try to get some downtime off of social media. Okay, I know that's hard. Y'all got Snapchat. We didn't have Snapchat. Okay, and y'all probably got other apps I have no idea about. But try to get sleep. All right, because you gotta reset the clock. So sleep is one thing to decrease burnout. I talked about earlier in the convocation of knowing your bandwidth. Okay, don't feel pressure to say yes to everything. All right, you all are bright students. If someone asks you to do something and you don't have the bandwidth to complete it, just say no. That's easier said than done. It took me a long time to get to that point. My wife will tell you that. Anybody follows me on if people follow me on Facebook, no, I'm always traveling, coast to coast. And finally, the president, also my wife, was like, we need to slow down a little bit. And I'm like, yeah, we do. Because I'm pretty extroverted, right? I get my energy from being around people. But as I've gotten older, I also realize the importance of solitude and reflection. So say no. Don't be afraid if you say no that people won't ask you again. Actually, people will respect you more if you say no, because if you keep saying yes, then you become that yes man and yes woman of like, well, Frank said yes to this, he'll say yes to anything. No, say no. That also decreases burnout. Okay? And then I would just say the last thing, do the things that you enjoy doing. Okay? Whether that be athletics, whether that be drawing, art, do something that fills you up. Okay? That's running for me, that's Zumba, cardio dance class, or that's hanging out with my wife, hanging out with my daughter. Do the things that make you feel whole. Because that's one of the reasons why when you apply to Monmouth College and other schools, people liked your application. Not because you had just a 3.9 or whatever GPA, they like that you were well-rounded. You have to stay well-rounded. You know, they look at studies where as you go from high school to college and even in grad school, your extracurricular activities seem to try to drop off because we're so busy. But I got news for you. If you think you're busy now, you haven't seen busy. All right? And I hate to break that to you, but college was one of the best times of my life. I mean, despite everything I went through, I enjoyed college. But I also enjoy being in my 30s and almost being 42. There's something about that maturation process. But those are the things that I would say to decrease burnout. So, well, I want to be respectful of everybody's time because I want you guys to get a good night's rest. And,